hormone therapy to treat menopause symptoms, seeing a decline among women, even though it is proven to be effective. That from a study by the Mayo Clinic recently published in the Mayo Clinic Proceedings, saying that hormone therapy has dipped in the last 15 years or so. Joining us now is Dr. Stephanie Faubion with the Mayo Clinic to tell us more about this. Doctor, thank you for joining us.
Thanks so much for having me.
Yeah, I got the pronunciation right there. Faubion, is that?
Exactly right.
Okay, I just want to make sure. This is interesting. You have been, tell us more about your background and your involvement in the use of hormone therapy to treat menopause.
So I've been in this space and treating menopausal women since about 2005 when we first opened the Mayo Clinic Women's Health Clinic. And that was in response to the Women's Health Initiative results being published in 2002, which showed a big drop in the use of hormone therapy. And back then when that happened, it was that women couldn't get treatment and it simply was not prescribed anymore because people were so afraid of it. So that's what got me into the space in the first place.
Well, then tell us too, then from that time until now, I mean, had you seen a point where hormone therapy was becoming more used before you've seen this drop now?
No, I think we have to go back to that date. So the Women's Health Initiative trial results were published in 2002. And putting this in perspective, prior to that, almost 1/4 of the United States women who were postmenopausal were using hormone therapy prior to the publication of the trial. After the trial results were published, the usage rates dropped dramatically from about 1/4 to about 4 to 6%. And that remained steady through another set of publications that came out around 2012 that showed it was still around 4 to 6%. And so the reason we did the study was to say, hey, it seems like everybody's talking about menopause a lot more. Could it be that hormone therapy usage rates have picked back up again? But what we saw instead was that the usage rates were even lower than they were in 2012 when the last studies were published. And we found that if you look at all postmenopausal women, it's about 1.7% of those in the United States were using hormone therapy systemically at the end of 2023.
What do you attribute that continued decline to?
I think there's still a lot of gaps in education, and they're not just because women aren't aware of it. It's also because clinicians haven't been educated in menopause. Essentially, what happened after that trial was that we stopped teaching about menopause, and people no longer felt comfortable prescribing it in their practices because everybody assumed there was just nothing to do for menopause. So we didn't teach about it. We didn't teach about hormone therapy. And it's had a hard time getting traction back in the educational programs, such that even recently there have been studies that have shown that most clinical training programs, medical schools, residency programs are still not teaching about menopause or hormone therapy use.
So what then here, we got about a minute left. What is your message as somebody in this space about the use of hormone therapy to treat these symptoms?
Well, I think women have to understand that there are treatment options available. Not everybody is going to want to use hormone therapy, nor should everyone be using hormone therapy. But this is a universal experience for women, and women shouldn't be suffering through it. So if your clinician is telling you nothing can be done, that's not the right answer. We have lots of safe and effective therapies, including hormone treatment.
But clearly there have been some rising concerns about the safety.
Those came about after the WHI. I think now we have come around to say that for most women who are under the age of 60 or within 10 years of menopause onset who have bothersome symptoms, that is safe and effective.
Okay. All right. And appreciate taking the time here. So I wish we had more time, but we've had a lot going on today. But very interesting to talk about. Dr. Stephanie Faubion with the Mayo Clinic about the the concerns over the decline of use of hormone therapy and menopause symptoms. Thanks so much.